Every morning, millions of people reach for a small plastic bottle, shake a single pill into their palm, and swallow it with a sip of water. It takes about 3 seconds. It's so routine, so automatic, that most people could do it in their sleep. But here's a question that very few of them ever stop to consider. What if that tiny pill, the one you trust to keep you safe, is quietly setting the stage for something you never saw coming? Not because it's a bad medication, not because your doctor made a mistake, but because no one ever explained the hidden rules that govern how it actually works inside your body. Rules that change when you get sick. Rules that shift when you add a common pain reliever. Rules that can turn a harmless leg cramp into a warning sign that most people walk right past. By the end of this video, you're going to see these medications in a completely different way. You're going to understand the subtle signals your body has been sending that most people dismiss as normal aging. And you're going to walk away with practical knowledge that could protect you or someone you care about from a preventable crisis. Let me take you back to a story about a man named Frank. Frank was a retired carpenter, the kind of man who could look at a house and tell you exactly when it was built and what was wrong with it. He applied that same meticulous attention to his health. He never missed a dose. He used a pill organizer his daughter bought him. Every Sunday night, he would fill it up like clockwork. When his doctor prescribed a new blood pressure medication to help bring his numbers down, Frank assumed it was more of the same. Just another pill to do the same job. That assumption nearly cost him his mobility. 6 weeks after starting that new medication, Frank noticed his shoes felt tighter in the afternoon. By the end of the day, his ankles looked puffy. His socks left deep indentations in his skin. He told himself it was the heat. He told himself he'd been on his feet too long. He told himself it was just part of getting older. But the swelling got worse. His legs felt heavy, like they were filled with lead. He started limiting his walks because moving around made him uncomfortable. He stopped going to his favorite hardware store on Saturdays. Frank started Googling his symptoms. Heart failure came up. Kidney disease came up. He spent 2 weeks terrified, convinced his body was shutting down. When he finally went back to his doctor, the explanation was almost anticlimactic in its simplicity. The medication was doing exactly what it was supposed to do. But Frank had no idea that the drug he was taking works differently from other blood pressure pills. It relaxes certain blood vessels more than others, creating an imbalance that pushes fluid into the lower legs. It was a known effect, a common effect, a manageable effect. But Frank had suffered for months because no one had ever broken down the science in a way that made sense to him. And that is the heart of the problem. People are walking around with powerful medications in their systems, making decisions based on guesswork, fear, and incomplete information. They are interpreting their body's signals through a lens that was never properly focused. So let's clear the fog. The first thing you need to understand is that these are not interchangeable drugs. They all lower blood pressure. That's where the similarities end. One medication works by relaxing the muscular walls of your arteries, opening them up like widening a garden hose so water flows with less resistance. A different one blocks a specific enzyme that constricts your blood vessels, preventing that constriction from happening in the first place. A third takes a similar approach, but through a slightly different doorway in your body's chemical system. 3 distinct mechanisms, 3 distinct side effect profiles, 3 distinct sets of warning signs. When you understand that, you stop treating every symptom with a one-size-fits-all panic response. The leg swelling Frank experienced, the symptom he mistook for heart failure, is a textbook effect of one specific medication. It happens because the arteries leading into your legs relax more effectively than the veins that carry blood back up to your heart. More blood flows in than flows out. Pressure builds. Fluid escapes into the surrounding tissue. By late afternoon, your ankles look like they belong to someone else. Now here's the part that genuinely frightens me. Not the swelling itself. The swelling is uncomfortable, but it's rarely dangerous. What's dangerous is how people respond to it. Some people see the puffiness and decide to stop the medication cold turkey. No phone call, no conversation, just a decision made in isolation, while their blood pressure climbs back up quietly, silently, until weeks later they have a reading that scares them even more. Other people take the opposite approach. They start avoiding water because they assume they're retaining fluid. They reduce their intake to dangerous levels, and dehydration combined with this class of medication creates a different set of risks entirely. Some people like Frank just endure it, suffering in silence, reducing their activity, losing quality of life unnecessarily. The right move is so simple it almost hurts to say it. Leg swelling is a conversation starter, not a life sentence. It is information your doctor needs, not a verdict on your health. There are adjustments, alternatives, strategies that can make it manageable. Elevating your legs, changing the timing of your dose. In some cases, reconsidering whether this particular medication is the best fit for your body. But none of those solutions come online if you suffer in silence. Now let's pivot to another medication, one that belongs to a different family, with a completely different calling card. This one is famous for a symptom that sounds trivial, but can drive a person to exhaustion. A dry cough. Not a wet cough, not a productive cough, a dry, scratchy, relentless tickle in the back of your throat that doesn't respond to cough drops, lozenges, antihistamines, or anything else you can buy at the drugstore. It's worse at night. It disrupts sleep. It makes conversations awkward because you keep clearing your throat. And here's the cruel irony. It often doesn't show up immediately. Some people develop it within the first week. Others take 3 or 4 months before the cough appears. By that point, they've been on the medication for months without issue. They don't associate the cough with the pill. They blame allergies. They blame dust. They blame a lingering irritation from a cold they had months ago. Consider a woman I met named Eleanor. Eleanor was a retired school teacher who loved nothing more than spending time in her garden. When a persistent cough started in late spring, she assumed it was pollen. It made perfect sense. She started using antihistamines. She bought an air purifier. She mentioned it to her doctor, who ordered a chest X-ray that came back clear. 6 months later, the cough was still there. Her sleep was disrupted almost every night. She was tired, irritable, and starting to believe something serious was being missed. She had reached a point of quiet desperation. When she came to see me, one of the first questions I asked was, "When did you start this medication relative to when the cough appeared?" She went quiet. She started doing the math on her phone. She had started the medication 11 months earlier. The cough had appeared about 4 months into treatment. She had never made the connection. Once we identified the likely cause and worked with her primary doctor to switch to a different medication that targets a similar mechanism but doesn't trigger this type of cough, the tickle in her throat was gone within 2 weeks. 11 months of disrupted sleep, gone in 14 days. Now, I need to draw a very clear line here, because there is a symptom in this category that is not a nuisance. It is a medical emergency. If you develop swelling of your lips, your tongue, your face, or your throat, especially if swallowing or breathing becomes difficult, you do not wait. You do not call the office tomorrow. You do not take an antihistamine and see what happens. You call emergency services immediately. This is a condition that is rare, but it is real, and it can close your airway faster than you expect. A dry cough is a nuisance. Throat swelling is an emergency. The gap between those two things is too important to blur. Now let's move to a different danger entirely. A danger that doesn't come from doing something wrong. It comes from doing what you believe is the right thing. Some of these medications affect how your body handles potassium. For most people, this stays within a safe range when monitored appropriately. But add certain common lifestyle choices on top of it, and the picture changes. Here's where it gets counterintuitive. Potassium doesn't just come from bananas or supplements. It's hiding in products that are actively marketed as the healthier choice. Salt substitutes. Many popular low-sodium salt alternatives replace sodium with potassium chloride. They sit right next to regular table salt in the grocery store. They're often branded as heart-healthy. So a senior who's been told to cut back on salt buys a potassium-based substitute, uses it liberally on every meal, and is now loading potassium into their system while taking a medication that already raises potassium levels. The combination can push potassium high enough to affect the electrical system of the heart. And here's what makes it dangerous. High potassium doesn't always scream at you. It sometimes announces itself quietly as unusual muscle weakness, persistent fatigue, a cramping sensation in the legs, tingling in the hands, or a fluttering, irregular heartbeat. Sometimes there are almost no symptoms at all, right up until there are serious ones. I want you to think about someone in your life right now who has switched to a salt substitute in the last year or two. If that person takes one of these blood pressure medications, this is a conversation that needs to happen with a doctor. Not because the medication is dangerous in isolation, not because potassium-rich foods are evil, but because the combination, without awareness and monitoring, can create a slow-building problem that never needed to exist. And while we're on the subject of hidden sources, electrolyte powders, meal replacement shakes, sports recovery drinks, they also carry meaningful potassium loads. They're not prescription products. Nobody thinks to mention them. And that's exactly why they matter. Now let's talk about a scenario that I don't think gets nearly enough airtime in conversations about blood pressure medications. What happens when you get sick? Not a serious illness, not hospitalization, just a bad stomach bug. A few days of vomiting, diarrhea that won't quit, loss of appetite for a couple of days, or simply a hot week in summer with heavy sweating and not enough fluid intake. When you're dehydrated for any reason, the same dose of medication that was perfectly calibrated for a well-hydrated body can act dramatically differently. Your blood pressure can fall too low. Your kidneys, which are already working harder due to the fluid loss, become more vulnerable. Dizziness, weakness, faintness, acute kidney strain can develop faster than most people expect. The medication didn't change. Your body's internal environment changed. The drug is now operating in conditions it wasn't designed for. This is one of the most important practical things I can tell you today. Illness changes the rules. And if you don't have a plan for what to do when illness hits, whether to hold a dose, when to call the doctor, what symptoms should trigger a visit, you are leaving a significant gap in your safety. That plan is something you should have from your prescribing doctor before you ever need it. If you don't have it, ask at your next appointment. What should I do with my blood pressure medication if I get a stomach virus or can't keep food and fluids down? It's one of the most important questions you can ask, and it's one of the least commonly asked. And here's another common scenario that slips through the cracks. Imagine you're having a bad week. Your arthritis flares up. Your knees are aching. Your back is stiff. You head to the drugstore and pick up an anti-inflammatory pain reliever, something you've used for years, something from the shelf that anyone can buy. Now you're taking a blood pressure medication. Maybe you're also on a diuretic, a water pill for extra fluid management. This combination, when used regularly, can meaningfully reduce blood flow to your kidneys. And in the context of even mild dehydration, the risk of kidney injury rises substantially. This is not a hypothetical rare scenario. It is one of the most common, most preventable situations I see. And the reason it slips through is simple. Patients don't think of over-the-counter pain medications as real medications in the same category as prescriptions. They're just something from the drugstore, something for the pain. But your kidneys do not distinguish between prescription and over-the-counter products. They respond to chemistry. If you routinely use anti-inflammatory pain medications for arthritis, joint pain, or back pain, and you take any of these blood pressure drugs, please have that conversation with your doctor. There are often safer alternatives. Simple pain relievers that work differently. Topical treatments. Physical therapy approaches. Other options that don't carry the same kidney risk. You don't have to simply endure the pain, and you don't have to silently accept the risk. There's usually a better path. You just need someone to help you find it. Now let's spend a moment on something that sounds small and isn't. Dizziness. That brief, wobbly moment when you stand up from the couch or get out of bed in the morning. The world tilts for a second. You grab the door frame. Then it passes and you go about your day thinking, I just got up too fast. For many people on blood pressure medications, this is a regular experience, and it's almost universally underreported because it seems too minor to mention. Here's what I need you to hear. In older adults, a few seconds of dizziness is enough to cause a fall, and a fall is enough to cause a fracture. And a fracture, particularly a hip fracture, can derail an older adult's health trajectory in ways that take years to recover from, if recovery happens at all. This isn't alarmism. This is physics and biology working together in a way that demands respect. The dizziness happens because your blood pressure medications are doing their job. They're lowering your blood pressure, and when you stand up quickly, your cardiovascular system hasn't had a moment to compensate. Blood pressure briefly drops. Blood flow to the brain momentarily decreases. You feel it as a light-headed tilting sensation. The fix is often simple. Rise slowly. Sit on the edge of the bed for a moment before standing. Hold on to something stable when getting up. Give your body a few extra seconds to catch up with the change in position. But beyond the practical adjustment, dizziness that happens regularly, dizziness that doesn't improve after the first few weeks on a medication, or an episode of near fainting, those are signals that deserve a real conversation. The dose may need adjustment. The combination of medications may need review. Something in your hydration habits may need to change. Silence on this issue is not a small risk. And while we're on the subject of monitoring, let me address something that creates enormous, unnecessary anxiety and occasionally dangerous, impulsive decisions. Blood pressure is not a fixed number. It moves constantly throughout every hour of every day in response to dozens of variables. How well you slept, whether you had caffeine, if you're in pain, whether you're anxious about the reading itself, whether you just walked in from outside, whether you spoke loudly right before sitting down. A single high reading on a random Tuesday morning after poor sleep does not mean your medication is failing. A single low reading after you've been dehydrated on a hot day does not mean your medication is too strong. What matters is the pattern over time, measured consistently. The same arm, the same time of day, after 5 minutes of quiet rest without rushing or talking. When people monitor inconsistently and react emotionally to individual readings, the decisions that follow are almost never good ones. Extra doses taken out of fear, skipped doses because one reading looked good, frantic calls to the doctor about a number that, in context, was completely unremarkable. Monitor with a method. Track over time. Bring the log to your appointment. Let patterns, not panic, guide the conversation. That simple shift in approach reduces anxiety, improves decisions, and gives your doctor far more useful information than a single alarming screenshot from your home monitor. These medications work through a steady, consistent presence in your system, not spikes and gaps, not extra doses when you're worried, not skipped doses when you feel fine. They're not designed to be taken reactively, like a pain reliever after a headache appears. They work because they maintain a consistent level in your bloodstream over days and weeks. The moment you start playing games with your dosing schedule, you're not just undermining their effectiveness. You're introducing instability into a system that thrives on predictability. So, let's bring this all together. The medications millions of people take every morning are powerful tools. They save lives. They prevent strokes. They protect kidneys. They allow people to live longer, healthier lives. But they are not magic. They have rules. They have quirks. They have hidden interactions that only become obvious when you know where to look. You now know that leg swelling isn't heart failure. It's a conversation starter. You know that a dry cough that won't quit might be your medication, not a mystery illness. You know that a salt substitute might be raising your potassium in ways your heart can feel. You know that illness changes the rules, and you need a sick day plan. You know that over-the-counter pain relievers carry real risks when combined with these drugs. You know that dizziness is not just a nuisance, it's a fall risk that deserves attention. And you know that home blood pressure monitoring is about patterns, not panic. Every single one of these insights has the power to change how you approach your health. Every single one of them could prevent a complication that never needed to happen. Every single one of them came from someone asking the right question, paying attention to the right signal, having the right conversation with their doctor. Frank eventually got his life back. Once his doctor adjusted his treatment, the swelling in his legs resolved within weeks. He started walking again. He went back to his hardware store. He told me it felt like he had been given a second chance. Eleanor stopped coughing. She slept through the night for the first time in nearly a year. She told me she felt like she had reclaimed a part of herself she thought she had lost forever. Their stories are not unique. They are happening all around you right now, to people who don't know what you know. People who are silently enduring, quietly assuming the worst, making decisions based on fear instead of understanding. You are now in a different position. You have the knowledge to interpret your body's signals more accurately. You have the tools to have more productive conversations with your doctor. You have the awareness to catch problems early before they become crises. That is the point of all of this. Not to scare you, not to make you distrust your medications, but to empower you, to make you an active participant in your own care, to remove the guesswork, to replace fear with clarity. You deserve that clarity. You deserve to understand what you're putting into your body every single morning. You deserve to know the hidden rules that govern how these medications work. And you deserve to feel confident that you are making decisions based on real knowledge, not blind trust. So the next time you reach for that bottle in the morning, pause for just a moment. Think about Frank. Think about Eleanor. Think about the millions of people taking these medications who never learned what you just learned. And ask yourself one question. What else don't I know? Because the more you learn, the safer you become. The more you understand, the more control you have. And that is the most powerful prescription of all.